Okay, so, we can talk a little bit about using antipsychotics. Think of it more of if you're in a pinch with patients who are hyperactively delirious and you need, immediate responses, both for their safety and your safety. You've tried redirection, it doesn't work. You've tried, your other more less medical approaches, not getting through to the patient. So you can try the antipsychotics. I know.
I had a patient when I was doing outpatient who was like 84, 85, and she had been on heavy duty antipsychotics most of her life because she'd been schizophrenic. By the time she was 85, half of a 0.5 milligram of Haldol treated her psychosis.
Oh, really?
Because she, that's all she needed.
I'm surprised she didn't have such resistance to it. No, that's all she needed.
It was all she needed, and no side effects. I mean, she was lovely.
I mean, the thing about the antipsychotics, everyone's really scared about the black box warning, that there has been. The black box warning is that there is an association between using the atypical antipsychotics and death in elderly patients by cardiovascular causes. We can go through some more of the technicalities about it. In all honesty, the studies that these are based on, they're a meta-analysis, so they put all the studies together, but when you take the studies out individually, none of them were statistically significant. But when you put them together, they were. And it's caused enough of a scare that people want to stay away from them. Now, I'm not saying there's not any validity there. I'm sure that there's something there that needs to be paid attention to. But when you're getting to the point where you're having to use these medications, you need to be thinking about quality of life in your patient. So are you going to, if you have no other choices, you've tried all these non-pharmacologic means, are you going to let them be miserable and unhappy and harmful to other people where they are required to be institutionalized and restrained for the rest of their life? Or are you going to take that risk and treat them? So I just kind of want to put this in your craw, but this is on a case-by-case basis whether you use the antipsychotics or not. I personally, there's this guy who runs the ICU at Vanderbilt. Eli, his last name is escaping me. No, no. I can't remember his last name. I'm sorry, but he runs a website and it's called ICUdelirium.org. It's a great website. And his recommendation has been that you try very low doses of Haldol, so 0.25 to 0.5, just like you were mentioning for your friend or your patient. And you try with those very small doses, and if you have to use them for more than, I think it's 2 milligrams a day, or for more than 3 or 4 days in a row, then you want to consider the atypical antipsychotics. It's kind of controversial whether the side effect profile actually is better with the atypicals, but that's his thought process behind it. What is his name? ICUdelirium.org, Vanderbilt. So just to kind of summarize what we talked about, natural process of aging is hastened by being hospitalized, so basically why we're having this talk today. Delirium is one of the more common hazards of hospitalizations, and it is very dangerous. But it is preventable. So you monitor their medications, you get them moving, you monitor the testing that you're doing, and you can potentially prevent a lot of cases of delirium. Oh, it just didn't come out so good. This is my baby's first birthday. We had a luau for her. And that's my husband and me, and then my parents right there, and then his dad and stepmom and his mom and stepdad, and there's baby.